What about postpartum depression? Is there a difference between that and the baby blues?
So postpartum depression is a clinically diagnosable depression that occurs within the first 6 months after birth.
Mm-hmm.
And then the baby blues would be, symptoms of depression, but maybe it's not extreme enough or doesn't have enough symptoms to be clinically diagnosed. But yet the woman knows that she's not feeling as happy or as spunky as she would normally be feeling.
How do you treat postpartum?
So things that I use, or ways that I prevent to begin with postpartum depression, would be through the use of omega-3 fatty acids throughout pregnancy. It's known that their use can decrease the amount of postpartum depression later on. Other ways to treat postpartum depression are to deal with any birth-related disappointments, traumas, anything that may have happened around the birth or perhaps in the family. So, listening to the woman's story about her birth experience or about life changes that were going on near or around the time of birth can be very important. Counseling around that can also be very important. Things that I would screen for when a woman is having postpartum depression are vitamin D status, which is certainly linked with mental health, depression, anxiety. Thyroid status. Oftentimes the fluctuations in hormones around the time of birth and delivery can affect our thyroid, which is very sensitive to hormonal changes as well.
All right.
And there can be either hyper or hypothyroid that can go along with that and be actually the cause of it. So those are two things that I would screen for when a woman is suffering with postpartum depression. And then treating those with either herbs, nutrients, or, if she needs, referring her to a medical doctor for some kind of drug therapy for those conditions as well.
But you try to treat it naturally first, and very often that works.
Oh, yeah. Very often that's successful. Proper
Actually,
nutrients.
the preventing
and,
from the get-go.
Preventing it from the get-go. I find, and I think that this is pretty universal among midwives, is that our clients are not suffering from postpartum depression as much as women who may have delivered in the hospital. And I don't want to put down doctors for the wonderful work that they do, but I think that midwifery care allows a woman to really experience her pregnancy and her birth and her life. She has an opportunity to really talk about them, which is huge for women, to be able to really communicate emotionally about their birth experience and about their pregnancy and what's going on in their lives. And midwifery care just allows for that in a way that obstetric care very often doesn't have time for. So that both prevents and decreases, postpartum depression in the long run. So in general, I don't see that as much, but I have seen it before, and I think that it can very, very much be linked to nutrient status and thyroid function.
Thank you for that information.